Good day, all. My name is Anika Wilson, and I am the Director of Health Services. I am an infectious disease epidemiologist. I just would like to take a moment to talk with you today about all of the safety measures that we have in place to bring back our Oklahoma City Public Schools families. Safety and health is at the paramount of all that we have done. What we have thought about is student safety, staff safety, and all of the persons that are contained in the district, and how we could be able to move through the pandemic in such a way that everybody is able to be safe and keeping things effective, and making sure that we're governing by the correct laws. We work very closely with our Oklahoma City County Health Department, their officials, their epidemiologists, and their administrator to be able to give us some guiding local level reassurance of things that are going on and be able to use that guidance. As well as the Centers for Disease Control, World Health Organization, Johns Hopkins University, to be able to aggregate data so that we will know how to maneuver in a pandemic for the state of Oklahoma. We want you to be able to trust Oklahoma City Public Schools because we have been working very hard to make sure that all of our students, when they return to our campuses, know that everything that we've done is to keep them safe, but we would like to make sure that they are academically ready for school. Whether we're starting on the 19th, your student is coming on the 19th, or if you're coming in the month of November, we are ready. We are ready to receive your students. And when I say that we're ready because we have personal protective equipment that has been ordered in an abundance to be able to carry us from now, and as we're going to be also reordering as times come to make sure that that is covered throughout the district. And in the personal protective equipment, what we have ordered has been gloves, masks for adults and children. We have also taken care of disinfectant wipes, and we have looked at other litany of items that may be needed. We have items that are specialized for our nursing team to make sure that they are effectively geared to be able to handle a student who may be positive or that may be presumptive or have symptoms of COVID-19. So Oklahoma City Public Schools will be strongly required on our campuses for face coverings, and that is face coverings of the nose and the mouth. We want to make sure that all of our families understand that modeling that behavior at home it will help exacerbate the students wearing masks. We want to make sure that mask wearing with our students, that they understand that the mask is to protect their fellow classmates as well as themselves. So properly wearing it and not touching the mask with their hands is going to be of utmost importance. So one of the other things that we are encouraging and will be doing on our campus is taking temperatures. And we ask that our families, before sending their child to school, to take their temperature. If by chance you don't have a thermometer at home, that's okay. Oklahoma City Public Schools has thought about that measure. And so we have put in temperature stands for our students and staff to be able to readily use at coming to school. And also we've asked that our teachers have thermometers available too. Just by chance, if a student is not feeling well in the classroom, he or she could be able to take a temperature and then govern the child accordingly, either going to the front office or to see the health official that may be at the school site. One of the other things that we have taken into consideration is signage. We have purchased signage so that it's very clear of the direction that we want our students to go. Whether it is elementary, middle, or high school, we will have signs that will talk about social distancing of 6 feet or greater, and making sure that your masks are worn appropriately. Also about hallways, which side of the hallway to walk on, if there is an elevator in a school site, where to stand in the elevator, just to make sure that everyone is social distance appropriately. One of the other measures that we have taken into account has been encouraging our parents, or want to encourage our parents, if you have a favorite water bottle that your child likes, we encourage you to have them to bring that to school, and so that they will be able to have water accessible. Our water fountains are on, but we just want our children to know that if they need that water during the day, that they could have that in a backpack. And some of our older students have some of their special plastic mugs, we encourage you to bring that to school. Practice about safe hand washing, and we have that in our health policy, that we encourage hand washing to be done every 2 hours for our students, whether they're coming in from the playground or if they're through with PE, possibly specials where they're handling of materials or instruments, things of that sort. We ask that our teaching staff help our children understand about appropriate hand washing. So just in case you don't know what that is sing the happy birthday song twice and you will have met that measurement mark for hand washing. So with our AB schedule, that gives us a chance to keep our kids, shorten our class sizes. And so with that, we're working with a smaller grouping of students. And in the public health world, they call that potting. And so we are keeping kids in cohorts, and we're keeping them together and moving them together throughout the building as much as possible. And so what that looks like in a classroom is, for our elementary sites, those teachers have taken time to actually label the desk and to keep materials together, so our kids are only handling their items in such of like a travel go container that will have all of their needed supplies. Our cubbies, we have some real spectacular looking cubbies out there to keep our backpacks safe and every other hook. Some have gone as far as wanting to, wrap those bags up so that your student, so you're comfortable in knowing that your child is safe at school. And then in the classroom, sitting facing towards the teacher, forward facing, and so that again it is keeping the communication and everybody in one direction and sitting in such a way that again social distancing is at the paramount. So our teachers have received personal protective equipment that will include wipes. And so we ask teachers between sessions or anytime necessary that they're wiping down those high touch point areas, whether it be doorknobs, tabletops, under tables, chairs, seats of chairs, and the legs of chairs, and just making anything that is in that classroom that those students are touching, and it could be multiple children touching that they're wiped down intermittently throughout the day. If we had a positive case in Oklahoma City Public Schools in our school sites, I just want to talk to you a moment about how we're going to handle that. On our respective campuses, our school nurses would complete a exposure risk assessment form. With that form, it would identify if the student is positive or a close contact to someone that has been positive. Then what we would do is we have a contact tracing team that has been put together in our health services side that will then reach out to respective families to let them know that the student has either been in a close contact or that has been explained to us that there is a child may be positive within the household. We would also give additional information to make sure that the families understand what COVID-19 is, give them any additional resources, and explain to them how we will also be sharing that information with the county health department for further contact tracing to be done. What we want to do is to be very transparent in our communication to give them the resources that they need if further testing needs to be done, and also connect them if no healthcare provider is on board with possibly the city, county, or other community partner agencies that would be able to possibly see them. Same for those students that are close contact. We will be working with those families to make sure that they understand the length of time that they need to be out, an explanation as to why, and again, giving them the resources that they need if in the event that they possibly may need to see a doctor or have further questions about COVID-19. For our adults and staff, we have a 587-CV19 telephone hotline number that they can call and report if they have a positive exposure and or if they were in a close contact with someone who is positive. So either or, whether it is the school nurse or healthcare official at the school grounds, or those students that are close contact, they will have a way to reach out and report that information. And then the contact tracing team will take it from there, working very closely with our city, county health department officials to make sure that that family has all of the services and resources needed to make the best informed decision about future testing and or coronavirus disease. We take this very seriously because it is at the paramount of our decision making of bringing back students. We want you to feel engaged with the decisions that we make. We've done this very educationally, and we have also thought about this process every step of the way. So when it comes down to the effectiveness of our cleaning of buildings, we have worked very rigorously with our custodial crew and making sure that they understand what our needs are and they are meeting our staff needs in our school buildings, and that they understand that kids are coming back and that they have a very vital role and importance to make sure that they're doing their part as we are doing ours. So constant communication is at key paramount here, that we're talking to all persons to make sure that every entity in a building is taken care of for the safety and well-being of students and staff. Our teachers have worked very hard at home and online, and they have engaged our students, and they are so ready to receive our students back. They have taken their own safety precautions in place, and some of them have even gone over and beyond to make sure that our classrooms are set up in such a manner that they are making sure that our kids are social distanced, to make sure that our kids have that they're able to see the instructor, that to make sure that throughout the day that they have the most important thing throughout the day, they make sure that with social distancing measures in place, that they can still be able to have fun and active learning, and they're engaged with other cohorts of students. So for the safety measures that we have stopped to really take a look and to dive into what is going to be best for our students and bringing them back, and working with our local, state, and federal officials to make the best decision possible. Trust us. Trust us that we know that every day we're going to do what's best for students, but trust that Oklahoma City Public Schools really is excited about bringing back students. Safety protocols have been written, health protocols have been written, and our teachers are ready to engage our students academically.